Congresswoman Debbie Mucarsel-Powell is now in her fourth day of a 14-day quarantine after possibly being exposed to the coronavirus. We ask her how this happened and whether state and local officials are moving too fast to reopen the state.
I had been waiting to drive down to Monroe County, especially because I travel back and forth from Washington. So I wanted to be as careful as possible. I also have my mom that lives with me. So I have been so careful on following every guideline by the book, making sure that when I come back from Washington, D.C., I isolate myself. I completely separate myself from my mother. And on Tuesday, as things started to reopen in Miami-Dade County and in the state, I went down to meet with fishermen and to talk to them about the bill that we had just passed on Friday, to give them information, because I know that they're in dire need. They're really hurting right now, our fishermen in Monroe County. And also to meet with the families of Crystal Health and Rehab, that nursing facility that we have in close to Isla Morada. So I went down. We had very small meetings following all the guidelines. I was wearing my mask, social distancing, a limited number of people, under 10 people in my meetings. And I heard of Brittany Baker, who is one of the residents. She's 30 years old, Jim, and she's at the Crystal Health and Rehab Center. She's been there for a few years. She sustained a major brain injury in a car accident. And her parents were telling me the story of Brittany and how she's right now in that center, and they can get absolutely no information. They can't get any information from the director of the center. They were in tears. They know that that's a hotspot right now with 15 residents who have tested positive and a few staff members as well. And they're not getting any information. And I find that completely unacceptable. We've seen the reports on that rehab center that the families found out that there were all those positive cases by the residents from the media. They were never notified. They were notified after. So I called where I was having these meetings was right next to that rehab center and nursing facility. So I called. I wanted to get information from the director, and there was no answer. So I drove down and I rang the doorbell and asked to speak with her, but I asked her to come out, and she didn't want to come outside. And she said, no, come inside. It's safe. You can be here. This is a safe zone. So I went in. I was hesitant, and we had a conversation where I was asking her to communicate with the families, asking what type of guidelines they were following. And I knew that there were several residents in there that had COVID-19, and she assured me that they were in a safe, in another area that was separate. I must have stayed there maybe for 15 minutes at the most. Inside, I didn't touch anything. I was always wearing my mask. I came outside, I immediately rubbed my hands, but then the Department of Health in Monroe County, Bob Eady, he's the director of the Department of Health there, called our office when he saw that I had gone into the facility, and he told me that she should have never invited me to go inside.
So what does this incident tell you about about that facility, and two, the larger state of where we are today as we start to reopen things in South Florida?
Yeah, great question. So first of all, we have known now for a few months that these nursing facilities are not following stringent guidelines. They're not communicating with families. They have become this petri dish of COVID-19. They're one of these spots that we need to make sure that they're following those guidelines so that we don't see, and also the staff members, because staff members are coming in and out and they can infect their communities as well. So it's exactly what she did, was exactly what the families have been complaining about. They're extremely concerned for the health and safety of their loved ones in the nursing facility. What it shows me also is that even in the most careful circumstances, Jim, I worked at the medical school. I have been surrounded by doctors and nurses for years. I've been in communication with Dr. Marty. I have been so careful that even when you're following every single guideline, that you could be unnecessarily exposed. And now I have to stay at home. I have to be extremely careful with my family. I'm going to have to go and get that test. And I promise everyone to show you, because I'm anxious about getting the test. I've seen the swab. It's not going to be a comfortable moment to go through that. And as we start to see things reopen and people start letting their guard down, this could be you. I mean, at any moment you can be exposing yourself, and then you're going to have to stay home for 14 days. You're going to have to get tested. That's a responsible thing to do. Some people actually haven't done that. I mean, we just saw Governor DeSantis, Jim, with Vice President Pence yesterday, visiting a burger store or a burger restaurant, and they weren't wearing any masks. And I didn't see that social distancing, which is extremely worrisome for me, especially as we start to reopen.
Well, let me ask you, are we reopening in Florida too fast? There's a lot of people who want to get back to work, who, are not being able to provide for their families, who are desperately worried, and they want to try to get back out. They want to try to get back to work. But are we opening too fast, in your opinion?
I think that the governor has made a series of mistakes, and he's failed terribly in Florida with Floridians. One of the things that we ask people to do early on is to stay at home, and which is why in Congress, House Democrats voted early on in legislation that would provide support to small businesses, that would provide support for Floridians who lost their jobs early on. In Monroe County, we depend heavily on tourism. So people have not had a paycheck for about 2 months now. And the governor has failed to fix the unemployment system to provide that assistance to Floridians that are in dire need right now. And now he's quick to open up because he doesn't want to have the responsibility of fixing that system. I commend Mayor Francis Suarez and the city mayor for Miami Beach, who have been much more careful in their decisions to open up. Having said that, at some point, we're going to have to slowly reopen. And I know that many people in Monroe County, we rely on tourism, and that's a tricky position to be in because you're opening up your doors for people to come out from the outside, most of them from Miami-Dade, where you see that it's a hotspot for us. So if people are following these guidelines, they're careful, they're strict with enforcing guidelines in these small businesses so that people are wearing their masks and do so, then we would be able to contain the spread. The question is, are people going to be responsible and use personal responsibility as we start to reopen the economy?
Well, you gave credit to Francis Suarez, and you talked about how other local officials may not be doing as well. I can't help but hear in that's a criticism of Miami-Dade Mayor Carlos Jimenez. Are you critical of what Mayor Jimenez has been doing in terms of opening up? It seems as if he tried to put out a very lengthy document trying to offer recommendations and policy guidelines as to how to open. Are you critical, though? Do you think he's made a mistake here? And if so, what is that mistake?
I think that we need to be extremely careful on what we're doing in a county where we have a large portion of the people that live here in Miami-Dade County, Jim, are Hispanic. We know that COVID-19 disproportionately affects communities of color, more so Hispanic communities. So when you have plans to open up in a community that's extremely vulnerable, you need to ramp up that testing. And I have not seen that in the county. I actually have to say that I've been advocating for those funds to come into my district, to the community health centers, where they have actually started. They were the first ones to start drive-through testing in Miami-Dade County. That was in Florida's 26th district. And I have not seen the structure in place. I have not seen the rate of decline for positive cases that we should be seeing. I'm concerned that, due to political pressure, maybe the county mayor is opening because, some of the people up top are telling him that that's what they want.
Do you have any evidence? Do you have anything specific with regard to pressure that Mayor Jimenez is acting on? Who actually is pressuring him, in your opinion?
Look, I have no idea, Jim, because I've been so busy going to DC and passing these bills and then coming back and doing work for my constituents. But what I can tell you is that what I was very surprised to see is that the first thing that he kept talking about that he wanted to reopen were golf courses. Now, I can tell you that in my district, people are not playing golf. We have a hard-working class that live in my district. The average income is under $44,000. What people need in my district are unemployment benefits. What they need in my district is PPE equipment, because a lot of them are those essential workers that never stopped working. They had to go to the grocery store to fill the supermarket aisles. And so, that seems so out of touch that was the concern. And what we need to be doing is talking about the reality that Latino communities are being affected by COVID-19. The unemployment rate for Latino communities is higher than any other group in the United States. And that's Miami-Dade County. So we need to look at that and see what do we need to do to protect our community from greater spread, greater loss of life, and provide that support, that economic support, as we ask them to stay home if they're feeling sick. You and I have had that conversation. Many people are scared to lose their jobs. And so they, even if they have symptoms, they're going into work. We need to make sure that a lot of these workers get paid sick leave, paid family leave, that they have those benefits so that we can protect all of us living here in the county.
We'll be right back.